So, looking now specifically at the definition of a receptive language disorder versus production or expressive language disorder. If they have a receptive language disorder, it's just about their comprehension. They're mostly going to have a hard time following directions, and sometimes they get mistaken for just being inattentive when maybe they don't understand the directions. It might be less obvious, but it can present a large problem in your classroom if a child isn't able to follow directions. When we talk about expressive language disorders, that's just about their production. So, thinking of speaking and writing, they might be reluctant to participate in activities that require them to speak out in class. They might use immature language because their language development is delayed. They could have difficulty relating personal experiences or using narratives to retell a story because that takes a lot of language ability. And this one tends to be more obvious to most than a comprehension disorder. When we talk about a disorder versus difference, and I kind of mentioned this in regards to dialects earlier, that's a really, really important consideration. So, for instance, English language learners is one category, but another couple examples, certain vernaculars, like in African English vernacular, there is a common use of an F sound for a TH sound. So maybe they would say whiff or bathroom, and that's not delayed, that's just the difference. Another thing I can think of is like that's an articulation difference, but I can think of when I spent some time working in Minnesota, and one of my first days there, my coworker said, "Can you borrow me that pen?" And I was like, "What?" And she said, I mean, this is a speech pathologist. "Can you borrow me that pen?" And I'm like, can you borrow this pen or can I lend you this pen?" And I quickly learned that they just say that there. And so to say off of that one phrase that that person has a language disorder is incorrect, right? We have to look at this whole picture. Is it a dialect difference or versus a delay or a deviance? And if we really are looking at a delay or deviance, language disorders can vary from mild to severe. And we want to look, when we're talking to parents especially, we want to avoid the term delay because it can give them kind of this false hope that their child can catch up. Clinicians and research do not use the term deviance because it kind of has a negative connotation to it, and there's nothing necessarily deviant or inherently deviant about them. They're just differentiating, they're just going off typical development in one way or the other.